Welcome to Berkshire Now News Magazine, where we explore news and views from around the Berkshires. This week, we will explore what we've all been waiting for, the reopening of Berkshire County. On May 18th, Governor Baker released a roadmap of how the state will reopen. This roadmap is the result of hundreds of hours of research and consultations with experts from around the state, the country, and the globe. It outlines a four-phase approach for the reopening process, with each phase depending on the success of the previous phase. Each phase is determined by the health metrics that monitor the number of new cases and deaths, among many other statistics. State Senator Adam Hinds has been a legislative observer of this process and is familiar with what went on in the crafting of this roadmap. Our discussion takes place about a week before Governor Baker's announcement. Adam Hinds, thank you so much for being with us today.
Thanks for having me.
I am very curious about some comments you made about the possibility that Berkshire County might get started with its economy a little bit earlier than maybe the rest of the state or even surrounding states. And I was wondering if you could address that a little bit.
Sure, and thanks for having me. It's really important that we're in touch with each other and across the community during a crisis like this, a pandemic. And you're right, the big topic this week and really next is the lead up to the May 18th deadline that the governor has said that that's when his economic reopening advisory board will submit recommendations for the gradual reopening of the Commonwealth. And so we're already seeing that at the time of recording that golf courses are going to be allowed to reopen with certain guidelines and restrictions. And so we anticipate that May 18th date is not going to be a switch of the economy, switching on, and more of being clear about what are the parameters for different sectors within the economy to open. And so, and then it'll probably be over time after the 18th. And so, what we're looking for is probably the fact that it'll have four main components. First and foremost is where are we from a health perspective that would allow either the Commonwealth or different regions to open? Are you seeing a decline in cases? Are you seeing a capacity in the hospitals with regard to ICUs? And do we have PPE and testing in place? And once you kind of check all of those boxes, then you can have the conversation about, which industries could open when. And so a lot of the work of this advisory board has been focused on which industries provide low risk and high economic benefit. And those would probably be included in the phase one of the opening. In New York, we saw their phase one plan that was released this week. They haven't started implementing it yet. But in phase one were things like manufacturing, construction, curbside retail, and then you kind of move on from there. And so that'll be a big part of what the report lays out. And then third, I guess, is what are the workplace guidelines that we want to see in terms of distancing? And maybe there's talk of, do you have different shifts that you didn't have before, so there's fewer people in a space at one time? Those types of considerations. And then finally, our testing and tracing capacity. So that's the general trajectory that it will be on. And then to your point, locally, we've been very clear that it's been a different response to the virus throughout the Commonwealth. We probably peaked in the 1st of April here in Berkshire County. I think that over in the Valley, Franklin, Hampshire, Hamden, they probably peaked around Easter, and then we've seen now Boston is only now coming off of a plateau that they've experienced, and so that's a pretty big gap in time. And moreover, just the real number of cases. And so we're down into just a couple of folks in the hospital with COVID right now. And so, it speaks to the idea that if you can achieve certain distancing in a workplace or in an organization or we're talking about some of our culturals, then why not start to kind of open up that valve a little bit?
Yeah, that makes sense. And, if I look at the numbers right, Berkshire County had 461 cases of the coronavirus with any number of cases or deaths is unfortunate, of course, but
Yeah.
we're at 37 deaths for the entire county at the time of recording this interview. And, I think that looks significantly lower than almost any other place in Massachusetts.
Yeah. Yeah. And
Is that your experience?
Yeah, that's right. And you can even parse the data further to say, we really were hit first and early, which I think in the end ended up serving us well because we just really locked down quickly and the health system responded incredibly quickly. The other piece to this is we've seen clusters of cases and some of these unfortunate deaths. And those typically we're looking at congregate care facilities and nursing homes. And so when you can now point to those clusters, then it further talks about the isolated nature of where this has ended up. This is all, of course, to say it's still very serious. It's still, this advisory board is said to me recently, one of the members, they're weighing this very stark trade-off of, yes, there might be economic benefit to reopening and it'll help individual lives and livelihoods and pockets, but there's a very clear awareness that by doing that, there will be more people who die. And so that's the heavy trade-off that's kind of being weighed through this process.
And that's got to be a very difficult situation. I mean, how do you decide, well, we'll let people make money or we'll let people die? I mean, that's just a terrible position to be in, and yet decisions have to be made.
That's right. And so it's literally, it's doing everything you can to make it as safe as possible. And we've seen lots of models around the world and the country where some people will, we saw China waited till almost zero incidents of cases before opening, and they seem to be doing well with their reopening. Spain went down to 20% of their highest rate of cases and reopened, and then they had to shut down again because it then went through the roof. And so you see others, Sweden, I think their model is a little more, you just isolate people when they contracted, especially older populations and vulnerable populations. And so we have the benefit of watching this the approaches taken in other locations, and that'll all factor in as well.
And what makes it so difficult is that once you contract it, you don't know you've contracted it for 2 weeks.
That's right.
And
it'll be spreading, yeah.
So, it's extremely difficult to contain it. And you mentioned tracking and tracing earlier. Are there any efforts to do that in Massachusetts?
Yeah, for sure. And so that'll certainly be a big part of this. And it's a pretty straightforward process that's been used in other illnesses where you immediately try to identify, and because of in this scenario where so many people are staying at home, you probably have had only a limited number of interactions in a given week. And so that process becomes a little easier, and you try to isolate. But that's also, it's a good point that this reopening plan will have to include resources for our local boards of health and departments of health to allow for that type of tracking and tracing once we do have positive cases, because that really is a big piece of the prevention.
It is. And, Google and Apple kind of joined forces to develop a piece of software that will sit on your cell phone.
That's right.
Is that anything that's being considered?
Yeah, that is useful, and we've seen it. Interestingly enough, there's a gentleman in southern Berkshire County who's been working with the city of New York to develop their apps for that purpose. And so there are a lot of programs out there, and you're right that's a key piece. Why wouldn't we use technology in a situation like this? And it also speaks to another element is. We had a rush on PPE, personal protective equipment, in the healthcare industry. And so we have to be incredibly aware of what happens when you now open that up for every individual, every employer, every employee looking for PPE. And so, that's another piece that another reason why you don't want to just turn the economy on. You want to make sure you have the right numbers in all of these other areas to allow for us to do it safely.
Well, that's interesting too, because where are employers and employees going to be able to get these supplies? Is there any help coming from the federal government or from the state government, or are they allowed to fend for themselves?
Yeah, it's all of the above. In the early days, it was certainly, we worked as a legislative delegation here in the county to release the federal stockpiles so our healthcare workers would have access to PPE. Now it's become a little more of a broader combination of health centers and various states going on the open market and trying to procure them. We've seen some pretty Herculean efforts locally with people making their own. And also some companies in the county have also opened up for or shifted focus. The big one being Boyd Technologies, which is life science material in any event. And then now they shifted to this focus, certainly for the short term. And they're able to develop large numbers. So it's kind of an all hands on deck, quite honestly. But it's true that we need to have the infrastructure in place to communicate with towns and individuals when they're distributing those.
Now, you mentioned federal stockpiling. Was some material stockpiled in Berkshire County?
No, it was the closest stockpile was Springfield, and so that was considered the Western Mass hub. It had a whole range of complications, quite honestly, both in getting it out and then the material that did come out. It makes you realize that there's, how do I say this delicately? There's going to be a pretty robust after action report on this one and how prepared we are for handling pandemics and major crises that impact the entire country at once. I mean, that's one of the really unique factors of this is we've had hurricanes, we have tornadoes, the like, but really to have something confront the entire country all at once has just, in my view, shaken how we've gone about this. And it means that we really, in these off years, have to make the necessary investments, which are always tough. And that's one thing we've learned is that when you don't have a pandemic, it's hard to take money away from another priority and put it into kind of treatment and prevention. But now, boy, when it hits you, you really wish you had it.
Indeed. And, it brings to light some of the statements that Bill Gates made 5 years ago. He had a TED Talk where he was just warning about this exact scenario.
Amazing.
And it's really amazing that he had the foresight, but he also had intimate knowledge of how budgets were being constrained and some supplies were being diminished along the way. And, if only we had listened.
That's right. And we do have interesting structures in place that probably most people don't even know about. And so we've seen, kind of command centers pop up in different districts, so North, Central, and South Berkshire County, and so we do have these structures that can be kind of operationalized at a moment's notice, and they typically focus on the first responders, and so a lot of work has been done, but you can tell that there's this is a whole new world, and I think we would be silly to think that this is the last pandemic we're going to see. It just speaks volumes to the world we're in now in terms of the movement of people and goods, and whether it's climate impact or health impacts. It's anything that happens in one part of the world now impacts the whole darn world, and we saw that with the economic crisis and the Great Recession as well. And so it's further underscores that we're all in this together, I guess.
Indeed it does. Is there anything else on your mind, Adam, that you want to impart to the residents of Berkshire County?
Yeah, so here we are. It's May, and we are really moving towards our seasonal economy, which is so important to Berkshire County. It's tourism and arts and culture are the third largest sector in our economy after healthcare and education, and we really we really need to do our best to make sure we don't see the long-term damage from this. And so a lot of us are focused on, okay, what are the pieces we need to have in place locally for a reopening? And you can imagine that means right now it's working with the state to see what we can open and make that case for a regional approach. And so once we have that, it's going to be very different in terms of how our kind of visitor economy works in terms of hotels and Airbnbs, and but also how many people can convene in one location. But we're going to try to do our best to make sure that that we don't lose an entire year, an entire season. And so that's a lot of the work that we've been doing, including working with the advisory board members to really get that message across. It's going to take a lot of teamwork and a lot of communication as we start to open up, so that everyone's aware of, what does it mean for local accommodations and when can they open and how. But I think, there's an interesting bigger picture here that I really want to get through as well, which is we've seen a shift in how a lot of things are happening because of COVID. So healthcare, we see maybe an acceleration of the trend towards telehealth and telemedicine. We can do an engagement like this. You can also do that with a healthcare provider and mental health care provider. Now we might see that happening more. Just as one example, we, as a state, allowed for reimbursement through insurance for telehealth, which we were having troubles getting that through before COVID. Another example, of course, is are people going to be remote working more? We've been talking with economic leaders who say, hey, we're not in any rush to shift back to in-place work. We're finding that people are productive, maybe even more productive in some cases. They're cutting down on transportation and maybe saving costs in other ways. And so Berkshire County is well placed to now make the argument that you should move here, work remotely, stay safe, enjoy the outdoors, and that could help a concerning trend that we had related to population decline in Berkshire County. And so that's another thing we'll be working on, is how do we pivot this and make sure that we're stronger after.
Well, that's a very good point. Traveling the information superhighway rather than some interstate.
That's right.
Yeah, that's interesting. Yes. Well, Senator Hinds, thank you so much for your time today. We really appreciate it. You stay strong and stay safe.
Thanks for having me on, and thanks for all the great work you're doing to keep everybody informed and involved.
State Representative John Barrett brings his perspective to us as of one day after the governor's announcement of the reopening plan. State Representative John Barrett, thank you so much for joining us today.
My pleasure, Bruce. Glad to be with you.
One of the things that we want to know about is the reopening of the state, and of course, in particular, Berkshire County. And I know that state representatives, to a certain extent, have been involved in advising the governor's task force on what things might be appropriate. Can you tell me a little bit about how that discussion went and what kind of things went into the planning phase of reopening?
Well, it's not so much we were part of the panel itself that made the decision, but we certainly had a lot of input into it. We met with the local representative that was on the panel for here. Senator Hinds was an observer. Unfortunately, he wasn't allowed to speak at the meetings and things like that. But we did get our point across on a lot of things that we were concerned with. We made individuals calls to the governor's office as well as the lieutenant governor, indicating what our concerns were. And obviously, one of them was that we have such a different type of economy out here in Berkshire County. We're a lot like Cape Cod, a lot of tourism here. We have a lot of art and cultural museums that are located here, a prime important part of our economy. And we're going to be hit very hard by the COVID virus, both economically and at the beginning we were hurt with a lot of people that we were one of the hot spots originally. And of course we had the situation at the Williamstown Commons where 24 people have now passed away as a result of this virus. So when you ask about opening it back up and the input that we had, I think my consideration had to be on the health side of things too. And the question in my mind, are we opening too early? Are we not opening early enough in the eyes of some people? And that's a tough decision that was left with the governor. The governor made that decision based on the data that he had, based on the input that he had from his reopening Massachusetts committee. I was surprised by some of the early ones that he put forth, and surprised that some others weren't included in phase one. But I think he's going about it in the right way and phasing it in, going about it very cautiously. What people have to understand, and sometimes we forget because the numbers are very low now in Berkshire County. The virus, however, is still here. We still don't have a vaccine for it. We still don't have a cure for it. And because of the good practices of the people here in Berkshire County, in my area of Northern Berkshire, where they paid attention, they stayed at home, they kept their social distance, they have started to wear a mask, which is going to be part of the new normal over probably for the next 12 to 14 months. And so that's one of the reasons why the numbers went by. You're seeing other things happening around the world, maybe not so much yet in the United States, but I would bet in the next month or so we're going to see an increase in the number of cases, of reported cases, as well as we're going to see more deaths, unfortunately, because there's a good possibility it will spike up unless these reopening rules are really looked at. Because you know how it is with everything else. Oh, geez, I got it made now. It's like the guy that thinks he's got his golf game perfected, and he goes out and shoots a nice score. The next time he goes out, it's not so good. And so it's the same thing with this virus. We have to keep an eye on it. We have to keep it contained, and that's what it's all about for the next year or so. Keeping it contained until they find that vaccine, finding a way that we have a cure for it. HIV, the virus, they never found a cure for it. We still don't have it. I shouldn't say a vaccination for it, or a vaccine for it, but they did find ways to cure it and work at it. So maybe that'll be that way with the virus. We just don't know.
You're right. We just don't know. And one of the difficult things about this is you've got the virus on one hand and public health, and you've got the economy on the other hand. And how do you balance those? Yeah, and that's got to be a really tough decision.
It's the hard part, especially out here in Berkshire County, in Northern Berkshire in particular. It's going to take us a long time to recover from this. When the largest manufacturer in North Adams announces they're going to be closing on June 19th, that coupled, which has nothing to do with the virus per se, and then you have the museum, which laid off, Mass MoCA laid off 120 people. Then we have the college, who employs over 300 people there, and many of our residents in the Northern Berkshire area work at Williams College. They have not made the decision whether they're going to open up yet. Then you couple it with the fact the Williamstown Summer Theater is not going to be open this summer. They're going to be virtually. You have the Clark Art Institute. Then where our hotels and our motels, the Lenox area is going to feel that same impact on it. So it's going to take a while for the Berkshires and especially Northern Berkshire to recover from this. So, but what's more important, I always say health. And, my father told me a long time ago, if you got your health, you got everything. And I think that's the way that we have to approach this. People have to realize, even though there's only a couple of cases reported here and there in their communities, the virus is still there, and it can be transmitted very easily from person to person. That's why social distance and these things, and hopefully we'll be able to get through it. But it's going to be a tough haul. It really is. And when the governor gets to phase 4 or 5, whatever it is, that's going to be the new normal. And that's where we're going to be at. But yesterday I got calls from hair salons and barbershops saying, we don't have any masks. We don't have any. They have to use paper covers instead of, they can't use cloth anymore. They have to, have a ton of sanitizer. They're having trouble finding that. And they basically can open in a week. I can guarantee that most of our hair salons and some of our barbers, they won't be able to open up for 2 or 3 weeks as they prepare for this. So it's a preparation, and that's the beginning of the new norm.
Now, I didn't notice in the governor's and his associates in this speech yesterday on the 18th, are they helping with supplies at all? Or are they just telling you where to get them?
They have been very good as far as our command centers have been in the COVID command centers, both in North County, Central, and Southern County, and making sure that we now have enough masks. We have that, but those are basically for our medical teams.
Yes.
Now we have to get into. I'm very concerned about it because right now there is not, and there's going to be a run on it now. Go try to find the paper covering that's going to go over someone who is going into the barber shop or going into the hair salon. You can't find them anywhere, and I've heard those calls. They're starting to have trouble getting the mask because there's now a run on that, and at the same time, the states around us are opening. I think if Massachusetts made one mistake, they should have started stockpiling these things, maybe 3, 4, 5 weeks ago, in anticipation that when these things would happen, how they would handle it, because our local businesses it's going to be tough for them. And then too, I find it ironic. Some of the retails are now going to be curb service, basically. If you want to go and purchase something in a clothing store, you can open up, but it's all going to be that you can pick up the item on the curb. Yet you can walk into Walmart without any problem. You can walk into Home Depot without any problem. Now you have stores that might have 2 or 3 employees max, and people can't go into there. So that's been delayed. That to me was confusing as to why they did that. It's the smaller businesses that I'm concerned about too, and I think my colleagues in the Berkshire delegation are concerned about it too, because we have the Lee outlets and a lot of the stores that are there, and a lot of people work there. But again, they're much smaller than a Macy's that's located in downtown Boston or in Springfield or a place like that. In the malls, they're allowed to. They can't open. Maybe it's based on that. But also the small clothing store that may be located in the downtown of one of our communities can't open either. They have to wait. So I think they've got to tinker with it. Overall, they've done a pretty good job.
I agree. In listening to the governor's press conference, it just seemed like that was a very measured, thought out, and well-researched project or process that they came up with. And I think it's probably one of the better in the country in terms of how he's approaching it.
And he's met with, I guess they've met with some of the local officials through the Mass Municipal Association, things like that. The big onus, however, is going to fall to local communities to do the enforcement procedure, and they've got to be consistent in how they handle it. The local health boards and the health directors there and their staff members, they're the ones that are going to have to deal with the complaints, because you're going to get complaints. You're going to get possibly complaints from a worker, or you're going to get a complaint from someone who's concerned about the situation when they went in there. So the health board has to play a very important. In fact, they are the ones that are going to be in the front line. They are the police, as the governor's office referred to them, that are going to have to make sure that these regulations are followed. And I think that's a difficult position to be in. I wouldn't want that job for all the tea in China right now. And of course, the local officials, the 2 mayors in the 2 larger communities are going to have to deal with it. But the secret to all of it, they have to be consistent, and people have to continue to cooperate. They cannot think that this thing is over, because that's the biggest mistake that anybody can make. This virus is still in our communities, it's still in our state, and it's still in our country, and it's still in the world. And the numbers are spiking up in those communities, not so much here, but the ones that closed down are reopened earlier in Europe and places like that. You're seeing big numbers start to spike there, and we have to take it seriously. And I trust the science on this. I wasn't very good in science in school, but I can tell you one thing. I want to trust the science on this, and if they're all saying the same things, you've got to be careful. You've got to treat this as a very, very serious pandemic, because it is.
John, thank you so much for your time today. We really appreciate it. And we hope you stay safe and well during this time of crisis.
Thank you, you too, and I hope everybody else that has a chance to listen to us, please pay attention to these things, and because it is important.
As you can see, there are still many issues to be resolved. As Representative Barrett says, if we all continue to do the right things to protect ourselves, our family, our friends, and our associates, we can collectively shorten the length of time each of these phases takes as we progress to the new normal. Until next time, stay safe and strong.